Hi all, today I am going to discuss a small topic of circumcision, its importance in the medical field. There are several indications for circumcision. We can split it into two mainly. One is religious circumcision, commonly done in Muslim communities, Jews, etc. And the other indication is medical indications. Medical indications of circumcision are expanding. So we will discuss the common indication where circumcision is mandatory and helpful. One indication is the phimosis. Phimosis is a condition. It's seen in all age group where the penile foreskin does not retract completely. It can cause recurrent urinary tract infection, also the kidney infections. It's more important in childhood urinary tract infection, especially male childhood UTI. After thorough investigation, a simple circumcision may be complete solution for the recurrent UTI. Second indication is paraphimosis. Paraphimosis is a medical emergency condition where the foreskin got retracted and it's not coming back. The glands and the penile foreskins gets edematous and swollen. So if it is not tackled emergency situation, it may compromise the blood circulation to the glands and also leads to subsequent complication. Then comes the Balanitis Balanopostitis, where the recurrent infections of the penile foreskin can be a bacterial infection, it can be viral, or it can be fungal, commonly seen in immunocompromised states like diabetes and other patients on immunosuppressants. So the organism gets lies under the penile foreskin. So circumcision is a complete solution where you can keep the glands hygienic and prevent the recurrent infection. BXO or Balanitis obliterans is a condition where the penile foreskin get whitish patch, and the main important thing is that this can affect the urethra also. So this condition also is completely cured from the penile foreskin by a simple circumcision. Then other indication where penile warts are there, sometimes a growth, small growths can occur in the foreskin. That can be a cancerous, commonly penile cancer. So this also is completely cured if in the initial stage by a simple circumcisions. So the importance of the circumcision is that it's very important to keep the hygiene of the glands, because if the foreskin is not retractable, the dirt get accumulated and it's a focus for infection of viral, bacterial and fungal. Also another important thing is that recurrent urinary tract infection in the females is commonly seen after the sexual relation or intercourse. So the couples get the infection, cross infection each other. So this is completely solved by the male circumcision. We have seen that a lot of literature supporting coming that premature ejaculation, that's a common indication where this male sexual problems comes like erectile dysfunction, premature ejaculation. Lot of youngsters or middle-aged old people are suffering from this. Maybe most of the cases are having a glands hypersensitivity, and some of the papers suggest that circumcision is a helpful solution as a part of the treatment for premature ejaculation in addition to medications. So finally I want to conclude saying some of the steps regarding the procedures. Commonly the circumcision is done in a traditional methods where the knife is used and foreskin is removed and the bleeding points are cauterized and stitches are applied. So the common apprehension among the people is because of the painful procedure, Second one, the complications of circumcision like hematoma, where the blood can collect. Second one, infection. Third one is the multiple stitches on the penis. Infection, especially in the diabetes. So it all can interact with their sexual function and also the aesthetic look. It will not be, in some cases, the circumcised penis may not look in a cosmetic. There may be edema and some swelling and etc. Very rarely the complications like glands injury etc. can happen. So these are the common apprehensions about the circumcision. So a complete solution has come for this. That is original ZSR circumcision, where the circumcision is done in 2 to 3 minutes under local anesthesia. It's a simple procedure where the circumcision is done with a stapler. It is totally painless, no bleeding and highly cosmetic. It's a clean cut and the wound gets blended by itself. So you cannot see any spot of the blood, and also the healing is very fast. Okay, the patient can go back to work on the same day itself. It doesn't require admissions. It's an OPD procedure where the patients can come and do and go back to home in another 20 to 30 minutes. That's all. And once the ZSR circumcision is done, some of the precautions you have to take. One is that you have to abstain from the masturbation for at least 10 to 14 days, and normal sexual intercourse can be started after 21 days. This is applicable to all circumcision, okay, to prevent the complication. And many of the complications of the traditional circumcision is abolished, or we can prevent by very easy OPD ZSR circumcision. Thank you.